it is important that the House Committee on ATM be on the same page with the Minister and the Ministry. This will ensure that programs and projects relating to the HIV/AIDS, tuberculosis, leprosy, and malaria are implemented seamlessly without any bottlenecks because they are critical to saving the lives of our people and Nigerians. My dear Coordinating Minister, we have always argued for increased domestic funding and less dependence on foreign funding for our health system, and as we are all aware of the withdrawal of financial support by the U.S. government funding for African health system. The Nigerian government has equally risen to the occasion by allocating more resources to the fight against communicable diseases such as HIV, tuberculosis, malaria, immunization, and so on and so forth. Thus, making the decision of the U.S. government to appear as if is a blessing in disguise.
Health is a responsibility of the federal government, it's a responsibility of all state governments, and is also the responsibility of local governments. There is no level of government that is absolved of responsibility in contributing to health. On the federal government side, we have corralled, we have signed compact, and we're working hand in hand with states and local governments. But the resources that the federal government is investing is not the it's not the totality. All levels of government, whether it's on malaria or HIV or TB or infectious disease or primary health care, all levels of government have to pull their weights so that we achieve. So just as you are focusing on this at the federal legislature, I also urge our state houses of assemblies and our elected local government levels to weigh in, because it's the three levels of government that will make this health system be transformed in the direction that the President has laid out, which is to build the human capital that will see to the growth and prosperity of this country. So that's the first point that I would like to make. The second point I would like to make is that if you look at the spending on health in Nigeria, we're not spending enough for the population, and there are many comparators. But for every, let's say, 1,000 naira that we spend, total health expenditure, about 100 naira will come from external parties, about 300 naira will come from all levels of government, and 60 naira is coming from private sources, households, and out of pocket. So the external component of our total health spend is less than 10%, is 10% or less of the total spending on health. Despite the abrupt nature of it, I think Nigerians can be rest assured that government is doing all that it can within its limited resources to ensure that we provide for the treatment of our population this year and also in the years to come, in terms of buying the commodities, bringing them in and distributing them. It may not be the same level as those who were bringing it through the external parties were doing it. They were bringing those resources from paying in US dollars. We have Naira. So we have to calibrate the expectation, but President Tinubu and his administration are doing everything possible to ensure that we protect the health and well-being of Nigerians. And the impact of the shift in U.S. policy is not one that we would allow, within the limits of what we have, to undermine the health of Nigerians.